Well, Maxgraft is an allogenic bone graft that originates from human donors. The bone blocks are treated chemically and are freeze-dried. The donors are selected very strictly with respect to any transmitting disease or general disease, so it is a safe product. I use the Maxgraft granules mainly for contouring and sinus floor elevation. The contouring after working with a bone block is pretty important to have smooth edges and to have a nice remodeling of the defect site. For the sinus floor elevation, I prefer to use it in combination with bovine bone. I can see a very good rehabilitation of the bone within the sinus, combining those two materials. As you can see here, the granules are very fluffy. That's one reason why I rehydrate the granules. Moreover, if you rehydrate the granules, they are very good to handle because they become sticky, so it's very easy to work with them. I rehydrate the granules sometimes with a saline solution, or if possible, and I'm able to gain blood from the patients, especially for sinus floor elevation, I like to rehydrate it with blood from the patient. And now you can see it becomes a little sticky, and now you can really nicely put it on the side and work on it. The bone blocks are delivered double packed and gamma sterilized, and with depending on the legal aspects of each country, you can store it in your private clinic for more than a year. And personally, I have a couple of bone blocks in my office, so I can use them at any time. The principle of the Maxgraft bone block is the osteoconductivity. That means we have a scaffold that allows the local bone to grow into the scaffold and remodel the whole situation. I very often observe after 6 months that the bone block is revascularized very well and remodeled in a perfect way. Not seldom I can observe also the new formation of a cortical layer on top of the former Maxgraft bone block. I'm using the Maxgraft bone blocks for several indications. Actually, it's the class 2, 3 and 4 defects according to the ITI treatment guidelines. That means in pure horizontal defects, in combined horizontal and vertical defects, and in single tooth defects I also use it for vertical ridge augmentation. Those blocks are available in 1 to 1 to 1 centimeter blocks or in 2 to 1 to 1 centimeter blocks. And as you might see, and if you look closely, you might find one surface that is more dense than the other sides of this block. And be aware to use this side for the screw for the later osteosynthesis. The handling is pretty easy because it is a little brittle, and you can easily work on it with the tongues like this, bone tongues, or you can also use rotating instruments, but be sure to hold tightly the block, not to lose it. And it is very easy to work on that, as you can see here with the tongs. And moreover, you can see that you gain some granules which might be used later on for contouring the block in the clinical situation. You have to try to adapt it in this way to the clinical situation, and that is much more easy compared to a cortical bone from the mandible or another autogenous bone block. The re-entry after performing such an augmentation will be after 6 months in my private office. Well, why 6 months? Because from orthopedics we know that the remodeling of an allogenic bone block might take longer compared to autogenous bone. That's why I try to be on the safe side. I make a CT scan after 5 months, and after 6 months I re-enter the situation and find a well remodeled situation in the patient. Well, the allogenic bone graft, the main advantage to use it, in my opinion, is first the free availability. Secondly, the origin of the material is from humans. That means the osteoconductivity is perfect. And this is something you can see by using those materials after 6 months. You won't find any remnants or anything left like from other materials. The patients do accept the material very well. They are happy not to have any donor side morbidity, and as I observe it clinically, the side events are minimal, so they are very happy with the material. Well, I'm using Maxgraft bone blocks now for more than 5 years, and the long-term results so far are very well. We have done biopsy after 5 years, and you can see a complete remodeling of the local bone. You have nice cancellous bone in the maxilla, so there is no remnant obviously to find in histology. One interesting thing about the volume of such a cancellous bone block is that there is almost no degradation of the block, so the volume remains pretty much consistent. We made an investigation where we compared the cancellous bone blocks with cortical bone blocks gained from the ramus of the mandible. And there was no statistical difference between those two blocks with respect to losing height or losing the transversal dimension over 1 year. So that means when you use, for example, cancellous bone from the hip, you might lose volume up to 30%. So you have to over-contour your local situation. With the cancellous bone blocks from Maxgraft, there is no need to over-contour the situation or the defect. So that is one big advantage of using the allogenic cancellous bone blocks from Maxgraft.